Officer of the Windsor-Essex County Health Unit. For those of you who are awaiting test results for COVID-19, you can now obtain your results online. Please check the Ministry of Health's online portal or the link on our website. Please note that at this time, our health unit staff will continue to follow up with you directly to provide your results. Please remember that while you are awaiting results, you must remain in self-isolation. Overall, 6,319 individuals have been tested for COVID-19, and of those tested, 821 tests are pending. I will now share the most current case counts. There are 50,026 confirmed cases of COVID-19 in Canada and 15,381 cases in Ontario. Chatham-Kent has 78 cases, and Sarnia-Lambton has reported 181 cases. Michigan now has 39,262 cases, with 8,811 cases being in Detroit. Today, we are reporting 586 cases of COVID-19 in our community, an increase of 5 cases from yesterday. 42% of our cases have occurred in long-term care homes, including both residents and staff. 179 cases have resolved. 24 people are in hospital. 17% of our cases are between the ages of 50 and 59 years, and 23% of our cases are 80 years and older. 40% are male, 59% are female, and 1% is unknown at this time. Our community has lost a total of 49 people to COVID. 35 deaths have occurred among residents in long-term care and retirement homes. Our health unit is currently working with 7 long-term care and retirement homes that are experiencing a COVID outbreak. Testing for COVID-19 is based on a clinical assessment. Symptoms of COVID-19 include fever, cough, difficulty breathing. Other symptoms may be present, such as being extremely tired, falling, nausea, vomiting, chills, headaches. If you are feeling unwell and need to seek a health assessment for COVID-19, there are several options. Complete the online self-assessment tool available at ontario.ca, contact Telehealth Ontario, call your primary care provider for a phone or virtual assessment. They will be able to guide you in next steps, including contacting public health or attending an assessment center. To access the virtual walk-in clinic, please visit ehealthwindsoressex.ca. Windsor-Essex has 2 assessment centers, Erie Shores Healthcare in Leamington and Windsor Regional Hospital Olette Campus. Please note that testing is available for people who have symptoms of COVID-19. Please continue to visit WECHU.org for the most current information and case counts. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health, for further updates regarding COVID-19.
Good morning, everyone. I am at a loss of words today to share the 6 additional deaths in our community as a result of COVID-19. 2 female in their 90s, 1 male in his 90s, 2 female in their 80s, 1 female in her 70s. I am truly sorry to see the loss of so many of our community elders. I and my team share our condolences with the families of these 6 individuals and wish them peace during this time. Last week, we partnered with Essex County Medical Society President Dr. Jennifer Bondi to launch the eHealth Windsor-Essex, an online portal for locating local primary care providers, walk-in clinics, and assessment for COVID-19. Primary care providers are in the best position to provide assessment of symptoms and referral for testing for COVID-19 or completing both assessment and testing on site. The Windsor-Essex County Health Unit wishes to remind residents not to forego important medical appointments and to engage with primary care for their essential health needs. Most services can and should be provided virtually. However, some in-person appointment must be maintained, such as those for pregnant women, newborn care, childhood exam, and important childhood vaccines. For patients going to an in-person appointment, follow these guidelines. Please call ahead and rebook if you are unwell. Wear a personal cloth mask to the office or clinic if you have one. Wash your hands prior to entering the clinic and after exiting the clinic. Avoid touching your eyes, nose, or mouth. From a primary care provider perspective, you should screen patients for symptoms over the phone prior to their appointment. Screen patients when entering the clinic and isolate appropriately. Stagger appointments and limit the number of people in the waiting room. It is important that people, and particularly parents, continue to see their healthcare providers for their essential medical needs. Routine childhood vaccines are vital for preventing outbreaks of their infectious and preventable diseases such as measles. With appropriate precautions, residents should feel comfortable seeking out these services, and with the help of eHealth Windsor-Essex, services should not be difficult to access. Thank you.
We'll now take calls from the media or questions from the media. We'll start with Blackburn.
I noticed there is an additional outbreak at a long-term care, which is the extended care Southwood Lakes. That's the latest one?
Yes, that is correct. We do have a case there, and any single case constituted an outbreak, so that's why they're going back into outbreak.
Okay, and they have been on outbreak before, right?
Yes,
I think that's all for now.
CTV?
Well, flattening the curve is kind of a big topic right now, but I'm just curious in terms of the LTCs, do you see a light at the end of the tunnel in terms of flattening the curve? Because it just seems like, we have 6 more deaths, and another outbreak. Are we getting over the hump yet?
I believe so, and we'll try and present some of that data on Friday too. What we have been noticing over the last few weeks is less community cases, more cases in the long-term care home, and it's unfortunate that many of the vulnerable people are in those long-term care homes. Many of them are sick and really frail elderly people, and unfortunately when COVID affects them, it can be fatal for them. So that's the unfortunate reality that we are seeing right now, and we may continue to see some of that until we get these homes out of outbreak and no new cases in those homes. But overall, from a community perspective, yes, we are seeing that impact, and it will be much more clear when we present our data on Friday.
Questions from AM 800?
Did you say, Dr. Ahmed, how many of the new deaths were residents of long-term care or retirement homes?
Of 6 deaths, 5 deaths were in long-term care home, and 1 was in the community.
Okay, thank you.
Any questions from Windsorite?
Of the 6 new deaths, did they have pre-existing medical conditions?
Well, most of the individuals who are in long-term care homes, they had a pre-existing medical condition, and the person in the community had a number of pre-existing medical condition that put her at the risk, and unfortunately she ended up losing her life to COVID.
Any questions from CBC?
Yes, good morning. We are getting some messages about people concerned about how the outbreak was handled at Country Village, since they are the long-term care with the most amount of cases. Do you have any concerns about the steps that the home took, or maybe the speed of which they acted?
Every time we declare an outbreak in any of the homes, whether it's a retirement home or a long-term care home in our community, we work immediately with the home to ensure that all the appropriate measures are taken to prevent and limit the spread of the outbreak. There are some instances where there are some realities like staff unable to provide staffing or not having enough staff to do the work that is needed. Some of these problems that we are seeing in the long-term care home, it's a systematic problem. It's nothing new that just immediately came out as a result of COVID. I think through appropriate channel that is currently being addressed. But rest assured that every time that we have an outbreak, our team is going in, doing the assessment, working with the home to cover all the issues that are needed to be addressed and ensure that all the help is provided to them.
Are there lessons to be learned then once this is over as to what long-term care and retirement homes should be doing, should be staffing-wise, so that this doesn't happen again?
Absolutely. I think there will be a number of lessons learned from everything we did in response of this pandemic, and everyone is watching closely through the province, Ontario Health, Long-Term Care Home Ministry, Public Health. We'll all come together and we will come up with more recommendations to make the system better, to address any of these future disasters proactively and put some mitigation measures in place to not to see this kind of impact in these facilities.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning. Have any additional residents been moved from long-term care to the field hospital?
Not to my knowledge. I think all those discussions are need to happen at a certain level. I'm not aware of any of those new transfers yet.
And I just want to be clear, is this the deadliest day that we've had on record? I think before it was 5 was the maximum reported at once.
I don't have that breakdown, but you could be right. I cannot confirm.
Okay, thank you.
Any further questions from Blackburn? CTV? Amy 100?
I'm good, thanks.
Windsorite?
No thanks.
CBC?
No, thank you.
Windsor Star?
No, thank you.
Thank you, everyone.
Thank you.
Just tell me when you want me to go. Do you have your mic?
Yeah.
Oh, this is yours?
Yeah.
Oh, okay.
Well, no, I have that little wire there.
Oh, the little wire.
Yeah.
Okay, because
Yeah,
last
well,
week, because we were trying to get the CTV thing in the
Oh, really?
in the
Yeah,
visual.
no, I saw a picture last week and I guess I should, but right, I should take advantage of it.
You do whatever you want to do.
They never could give me a mic stand, so either that or somebody ripped it off. But whatever, I'll just do it this way.
So we're at 9, but what? Just thought you just want to start, or you want to wait?
Oh yeah.
I can just leave this up until we're
For a
ready.
second, I think he should walk in the door before we.
Okay, we'll just give it a little.
I won't have too much else to. Oh,
There we go.
there he
We're
is.
good.
She thought she was gonna pull out her comedy routine.
Yeah, I'm like, oh, I don't have anything else.